Hello, how are you? Did you know that the cause of high blood pressure or hypertension is unknown in more than 90% of cases? Can you imagine if you could control your blood pressure without having to take medication? Is it possible to treat yourself without being at the mercy of the side effects of continuous use medications, which you'll likely be advised to take for the rest of your life? Well guys, the topic of this video is very important because I'm going to show you here how to get rid of hypertension. And it's very relevant. It is essential that you stay until the end of the video to not miss the opportunity to find out how to say goodbye to high blood pressure without having to take a million medications for the rest of your life. First things first, like the video, subscribe to the channel, and turn on the notification bell to always stay on top of the best and most up-to-date health information. And also share this video with someone, a relative, a friend who has high blood pressure, who is hypertensive, and who will greatly benefit from having this information from now on, because it can transform the lives of hypertensive people for the better and also the lives of non-hypertensive people who want to prevent this problem. And tell me, do you have high blood pressure? What medicine do you take? Enalapril, captopril, losartan. What medication do you take? Write in the comments and tell me from which part of the world you watch me because I want to get to know you better. And guys, I'm going to leave a warning here. You should not stop the medication without talking to your doctor. Any decision to change medications should go through the professional who cares for you. So I'm not here telling you to stop taking your meds. I'm here bringing you new alternatives for you to be aware of and talk to your doctor about them, okay? So we have more than 150,000 kilometers of blood vessels in our body, and the blood vessels, they carry and bring blood from all parts of our body. So all of our organs are supplied by our vascular system. And blood pressure problems, they don't just affect our vascular system and our heart. No, they affect our eyes, our brain, our kidneys, increase the risk of a heart attack, and increase the risk of a stroke by up to 3 times. And we see that the prevalence, the incidence of hypertension or high blood pressure increases over the years. So the older you are, the greater the likelihood that you'll have high blood pressure. We see that 50% of people over 60 have hypertension. So our channel audience is mostly over 45 years old. Most of our audience is over 45 years old. So if you're over 60, your risk of hypertension is extremely high. So it's very important. Pay attention to what I'm going to say. High blood pressure may be the body's way of compensating for some other problem. For example, hypoxia, which is a lack of oxygen, is common in COPD, chronic obstructive pulmonary disease. It's quite common in people who've used cigarettes for many years. What happens in COPD? The lack of oxygen causes the body to work harder to pump more blood around the body, increasing blood pressure. So the lack of oxygen in your body causes your blood to have less oxygen. Then your body understands that to meet the oxygen demands of tissues and organs, it needs to pump more blood. Because the blood has less oxygen, this ends up increasing blood pressure. So if the cause of high blood pressure is hypoxia, a lack of oxygen, and the person takes medicine to lower their blood pressure, they may even feel bad because their body will receive less oxygen than it needs, because their blood is not as oxygenated as it should be. So why do we have high blood pressure? There are several reasons, and I'm going to list a few here for you. First, low potassium levels, low magnesium levels, low vitamin D levels. So these 3 points are indeed related to high blood pressure. We see people with low levels of vitamin D being more likely to have high blood pressure, as well as those with low levels of magnesium and low levels of potassium. But what ends up gaining the most attention in our practice? When you go to the doctor and you have high blood pressure, do you think the doctor asks how your vitamin D is? Often he doesn't even ask for a vitamin D test to see how it's doing. What ends up getting the most attention in terms of blood pressure is sodium. So a very common guideline is to reduce sodium intake. They also already prescribe medications. We see, for example, that some diuretic medications such as hydrochlorothiazide deplete, as we say. They deplete water and deplete sodium, but then consequently, it also depletes potassium. That is to say, if you use hydrochlorothiazide, it is possible and even likely that your potassium levels will be lower. But then we just saw that low potassium levels are a cause of hypertension. So this medication ends up helping to perpetuate the disease. But folks, this is very common in these chronic use medications used to treat chronic non-communicable diseases, is that they end up controlling the symptom or the sign, but often they also contribute to the disease being perpetuated. The same thing with the prazoles, with the proton pump inhibitors, which end up making our stomach less acidic, when in fact we should be working to make our stomach more acidic. And we also see that when a person has high blood pressure, it is very rare to see someone doing potassium replacement. Besides potassium, hydrochlorothiazide can decrease magnesium levels and increase homocysteine levels, thus contributing to this ongoing issue of high blood pressure. So I was discussing hydrochlorothiazide. Now we're moving on to calcium channel blockers. These are also commonly used for treating hypertension, especially in African American patients. They tend to receive calcium channel blockers more often because studies show they are more effective in this demographic. However, if calcium channel blockers have been used for 5 years or longer, they can increase the risk of brain shrinkage and potentially increase the risk of certain cancers. Not to mention, they had questionable results in some scientific studies, which were poor. Some scientific studies indicated it only decreased blood pressure by 0.1. So if you have a blood pressure of 120/80, for example, it reduced your pressure to 119/80 or 119/79. So it decreased by only 0.1, which is very little. Then we mentioned hydrochlorothiazide, which belongs to the class of diuretics, calcium channel blockers. And let's talk a little bit about ACE inhibitors, angiotensin-converting enzyme inhibitors. Captopril, lisinopril, enalapril, these prills of life fit into the ACE inhibitors. They increase allergy risks, and quite a few people have chronic coughs using angiotensin-converting enzyme inhibitors. So we've discussed here the three main classes of antihypertensives. And I also want to talk about the importance of a substance called nitric oxide, because nitric oxide is a vasodilator substance and therefore lowers blood pressure. Interestingly, a little bit of medical history, that famous erectile dysfunction drug Viagra. It was discovered by accident while looking for a drug, an antihypertensive agent, and then they noticed one of the side effects of this antihypertensive agent was specifically to cause men to have erections, which is nothing more than of vascular origin. So Viagra, it's an inhibitor of phosphodiesterase 5, which is an enzyme that ends up participating in the production of nitric oxide synthesis. So when we vasodilate, our vessels open, they expand, and then make room for blood flow, allowing not only an erection but also a reduction in blood pressure, because if we have an increase in the lumen of the vessels, we reduce the pressure on these vessels. And some people end up not producing the enzyme that produces nitric oxide, whether it's due to a genetic variation or for some other reason. Those people are indeed more prone to hypertension. But doctor, how do I know if I have this deficiency in the enzyme? You can do the genetic test or the dosage of ADMA, asymmetric dimethylarginine, because the levels of that, if you have low levels of this asymmetric dimethylarginine, that indicates an unsatisfactory production of nitric oxide. And how can we increase our production of nitric oxide? In a minimally invasive, minimally harmful way, by taking L-arginine, which is a very common supplement. Guys, any supplement, any medication should be taken with medical advice, okay? And now let's also talk about some natural remedies for blood pressure. The first of these is garlic, which is a natural angiotensin converting enzyme inhibitor. So it works like captopril, like lisinopril, and it also increases nitric oxide levels, favoring the opening of vessels, vasodilation, and thus reducing blood pressure. In addition to garlic, we have celery, which has phytonutrients that lower blood pressure and also adrenaline levels. Plus, it's great for those who have sleep problems. So if you eat 3 or 4 celery stalks before bedtime, it will help you sleep. The endothelium is the layer that lines our arteries and veins. It's like vitamin E. It's a type of vitamin E. So it's beneficial for angina when the chest pain is stable angina. What is stable angina? When a person has chest pain when they're stressed, climbing stairs, or during physical activities, or unstable angina. What is unstable angina? When a person has chest pain even at rest, even if they're not stressed. And moreover, tocotrienols are also rich in antioxidants. To summarize here in our class, we said that low levels of some substances increase the risk of hypertension. So we need to have good intake of magnesium, which can be achieved through diet by eating lots of salad, veggies, and greens. Also, we need to increase our potassium levels, which can be achieved in the same way, eating lots of salad, fruits, veggies, and greens. Vitamin D through sunlight and supplements. So take at least 2,000 international units of vitamin D daily. That's our daily recommended intake of vitamin D. In addition, garlic, celery, L-arginine, and tocotrienols, which are interestingly present in annatto and paprika, which we use to give color to food. But annatto is a very healthy spice for our health. If it's healthy, it's for our health. But you can use a lot of annatto paprika because you're going to benefit a lot from it. And mainly, folks, a healthy lifestyle. This is irreplaceable. It's no use having good magnesium levels, eating garlic, taking L-arginine, eating annatto, taking vitamin D. If you don't exercise, if you don't sleep well, if you drink a lot of soda, if you drink like a drunkard, if you smoke like a chimney, so if you do this, no matter how many vitamins you take, your life will never be healthy and you'll never have the health you deserve. So you need to adopt an overall healthy lifestyle. But doctor, I don't know how to lead a healthy lifestyle. My doctors only prescribe medications. Doctor, I can't afford to hire a personal trainer, to pay a nutritionist, to get numerous tests. You don't need all that for a healthy lifestyle. You need one thing, I'll tell you. You know what it is? You need to read my book and implement the advice that I provide in my book. The name of the book is The Longevity Code, and it contains the 100 best habits for longevity if you want to live beyond 100 with good health, energy, and vitality. In this book, I provide a comprehensive step-by-step guide on how to have the healthiest lifestyle possible. If you follow 10% or even less, let's say if you follow 10% of the advice given, if you follow one piece of advice from each chapter, I am sure that your life will improve significantly. There are 8 chapters, so if you follow 8 of these 100 pieces of advice, your life will change for the better. And I can assure you, I guarantee so much that if you don't like the book, if you read it and don't like it, I'll refund your money. But it's not expensive. Rather, it's a worthwhile investment that will greatly and infinitely benefit you and your family just for $25.90. You just click on the first link in the description, get your book, read it, and implement what's in there, okay? Thank you very much for your attention. Now that you have bought your book, I request you to watch the next video being suggested to you. Over here, it's a very special video, which I picked out exceptionally, specifically for you, that I'm sure you will enjoy. Thank you for your time and attention. Stay here, take care, stick with us, and see you next time.